call upon next presenting author, Dr. Shruti Revankar.
Good morning, everyone. Okay. I'm Dr. Shruti Revankar, and I'll be presenting the visual outcomes in bilateral implantation of trifocal lenses with asymmetric light distribution. We know that cataract surgery has evolved over time, and so have the patient's expectations. All want a quality of life which they enjoyed before the aging process of the eye started, and to have an active life without being troubled by the use of spectacles. So how do we promise this to the patients? We have the single monofocal lenses which provide a very good distance vision, but they do not help in intermediate or near vision. Then we have the extended EDOF lenses that help in distance as well as intermediate vision, but do not help, the near vision is a downside. And then we have the bifocal lenses which help in distance and near vision, but do not help in intermediate vision. So to bridge this gap between monofocal and the bifocal lenses, the trifocal lenses were introduced, which generate a true intermediate focus, helping intermediate distance and near vision. So we studied one such new generation IOL, that is the geometry range of IOLs. We have two models in this. One is the geometry and other is the geometry plus. Both these models have a near IOD of 3.5 and intermediate IOD of 1.75. So how do these models differ? It is basically because of the difference in light distribution between the two models. In the next slide we can see, not showing. Okay. So basically the geometry lens, it provides a very good, excellent distance vision and a good intermediate and near vision. And the geometry plus, it provides an excellent near vision with good intermediate and near distance vision. So when we pair this by placing geometry in one eye and geometry plus in the other eye, it causes pairing of the light distribution because of the complementary light energy distribution profiles, and it causes, it results in an excellent near as well as far vision and a very good intermediate vision. So this is the percentage of light distribution between the two lenses. So the aim of our study was to evaluate the safety, efficacy, functional vision with bilateral implantation of these two lenses. It's a prospective single center study. We studied 52 eyes of 26 patients. There were no intra or post-operative complications noted, and all patients underwent flax. And we have a 2 weeks follow-up available. So we can see here, in terms of binocular distance unaided visual acuity at 2 weeks, 98% of the eyes had a 6.6 or better vision, and all eyes had a 6.9 or better vision. We also studied the near visual acuity, where all the patients had a near visual acuity of N6 or better, and some of them, like 39% of the patient had a vision of N5 also. The spherical equivalent lied between minus 0.5 to plus 0.5 diopters in 94.23% of the patients. We also studied the reading acuity and reading speeds using the Salzburg reading desk at 40, 66 and 80 centimeter at 2 weeks. We can see in the first graph, the reading acuity was better than 0.1, which corresponds to 7.5 Snellen's equivalent at 40, 66 and 80 centimeter. And also the reading speeds at the same distances was more than 150 words per minute. The defocus curve, we can see that there are 3 elevations, one at 0, other, the second one around minus 1.5 and third one around minus 3, which corresponds to the distance, intermediate and near visual acuity. And also the contrast sensitivity testing using the fact charts was better than, lying between the normal range in the graph as seen here. We also studied the patient satisfaction score and spectacle independence using the modified type questionnaire. So the patient satisfaction score was 9.54 out of 10, which was quite good. And spectacle independence was seen in 100% of the patients for all the distances, that distance, intermediate and near. To conclude, pairing the lenses is pairing of geometry and geometric plus lenses provides a continuous range of vision, high quality vision for spectacle independence from distance, intermediate to near, and also pairing is the most balanced combination for high spectacle independence from far to very near. Thank you.
Although the study doesn't give any major scientific contribution, it's a well-known fact, but the method of the study and statistical analysis, everything is very good, excellent. And the study was conducted well.